Hi everyone, this is Dr. K. I wanted to quickly talk about the deaths in the nursing homes that we're noticing lately. Initially, things were okay in Florida, but in the last 1 to 2 weeks, I got a lot of letters from the corporate essentially saying that there are more sick people coming in from the nursing homes, so just watch out for that. Hi, Patty. So that is true. There are a lot of I think COVID patients coming in from the nursing homes lately, especially here in Florida. I think that may be happening in other states also, but we noticed a lot in the local area. And unfortunately, this was bound to happen. The nursing homes were taking a lot of precautions. The first outbreak happened in Washington, I think close to Seattle, where they had a lot of deaths, and that's when the entire senior retirement industry figured out that this is going to be a huge challenge, and the people living in the nursing homes will be the most affected, and they're at risk for dying. So they took a lot of precautions. They restricted visitors, and they also made the residents or the people living there stay inside the rooms and not come out and congregate in the hallway or for lunch or dinner. So they figured that that would limit the spread, and they would do okay. It hasn't worked out that way. Eventually, we are seeing the virus spreading in most of the nursing homes, unfortunately. And there are a lot of factors. There's the healthcare workers are going in and out, and they're also interacting with their families who may be infected, and most of these workers may be asymptomatic, and I may be asymptomatic. I may have the virus, nobody knows. So similarly, these workers may be asymptomatic and they may be carrying the virus, and they're interacting with the residents staying in the nursing home. They may be spreading the virus unknowingly, so there's no point in blaming them. Also, there is a lack of resources. Healthcare in general is very expensive. If you go to an assisted living facility, they charge anywhere from $3,000 to $10,000 per month. But in spite of paying all of that money, the type of care that the residents get is most of the times very poor. In general, the staff usually don't have masks. They don't have protective equipment, so they don't have those resources. And the other issue is when you restrict the movement of the residents, when they stay indoors and they cannot come out of the room, it restricts their physical activity, and it reduces their immunity, and it also affects their mental state. So if you're stuck in your room all the time, you can't go outside, you can't experience sunlight, you cannot you cannot congregate, you cannot talk to any of your friends. Over time, the senior can become depressed, and once they're depressed and they're more emotional, then their immunity is suppressed. So that's another facet of the problem. And the third problem is the nutrition. They may not get the proper nutrition there. They may not get enough vitamins, enough enzymes, enough micronutrients, and that can weaken their immunity. So those are some of the major issues. And what also transpired here in Florida is that the government somehow restricted the numbers, so they were not publicizing them. Whether it is to hide the numbers or whether it's their policy, I don't know, and I don't get into that. Hi, Lorena. So because they restricted or they did not publicize the numbers, like the physicians and everybody else, we did not know which nursing homes are safe versus which nursing homes are experiencing a pandemic. We did not know that. There was a lawsuit filed, I think, somewhere in Miami, and now they're publicizing those numbers. Now they're showing the actual numbers in each nursing home. So that information is public now if you want to look that up. So because they did not tell the actual number, the public health authorities could not figure out where to put the resources to limit the spread. And the other issue is the admins of the nursing homes may or may not be willing to get support from hospitals or healthcare systems or outside, or healthcare workers from outside who are willing to help them. if they're not open to getting support from outside, um, they may not know what they're doing wrong, and that's another issue. So as you see, these are multiple factors that contributed to this epidemic of COVID-19 in the nursing homes, and unfortunately, this is what's causing a lot of deaths. See, it's it's easier to prevent the infection in the first place. Once the residents become infected, there's a high chance of them dying eventually. And the problem is, once they get infected and they're in the intensive care unit, they're not allowed to talk to the family. The family is not allowed to come inside the hospital. So there's nobody advocating for them. And when there's nobody advocating for them, then that leads to, most of the times it leads to poor care. So I also noticed there's a trend among a lot of senior citizens where they're putting do not resuscitate order on the living will. I think it's personal choice. If you want to put do not resuscitate, where you're essentially asking the staff to not put a tube down your throat for hooking up the breathing machine, and to not let them to do CPR to revive you, and that's perfectly fine with me. But unfortunately, what's happening is they're putting the do not resuscitate order, or they're choosing that because of COVID-19. COVID-19 is temporary. This is not going to last forever. But anyway, that's a new trend that I noticed. I just wanted to bring it to your attention. If you really don't have a living will, I think this is it's really important to have one, because it will give directions to the healthcare workers on what to do in a situation where you're unresponsive and you're not able to make decisions. So these are some of my thoughts about what's happening in the nursing homes and how this is playing out. Again, my goal is to advocate really good lifestyle, nutrition, so that you can enhance your immunity. This virus will keep spreading. Most of the young people may notice a minor infection here and there, and they'll recover. But it's going to affect the senior citizens in an adverse manner, and it will cause more and more deaths going forward. So the goal is to if you have grandparents or so, it may be ideal to just pull them out of the nursing homes and keep them at home for the next few months, if it is possible, because there are too many factors in the system which is actually broken. The whole healthcare system is, in essence, broken, and this was broken for a long time. It didn't happen in the last 3 years or 4 years. It was broken for a long time. We're seeing the results of that, where we're seeing a pandemic and we're not able to stop the spread because of a broken system. So it is prudent to bring your parents or grandparents outside of the nursing home and to start caring them at home, at least until this pandemic is over. So I would strongly recommend that if you can do that. So feel free to comment below if you want me to share something else about this. Comment below. If you want to reach me personally, you can send me a DM or call me. I look forward to talking to you all again. Okay, have a good night.